What's up, guys? So recently I was asked to give a talk about capacity and medical decision capacity, because oftentimes as a psychiatrist we may be consulted to sort of address this or try to find out if a patient has capacity or does not. And so you can take a look at this talk that I gave over Zoom for the hospital just earlier this week, and hope you guys enjoy.
So looking at our participants, it looks like everybody has their name connected with their Zoom entrance. So we have captured your attendance. At any time during the education, you can enter a question or a comment in the chat box, just as a learner had done right before we started. So at the bottom of your screen, you'll see a grayed out chat icon. And if you click on that and open it up, you'll be able to type in a message to everyone or a question to everyone or one person in particular. We'll probably have about at least 15 minutes at the end of this education for an open Q&A platform. So at any time, if a question pops into your head regarding what's being discussed or the content, please be sure to put it in here and to put it to everyone. And I will be collecting those questions to ask Dr. Collada and Emma Cook at the end of the education. And if you're experiencing any technical issues, make sure that you, instead of chatting everyone, you use a drop-down menu to chat Jorge specifically, Jorge Rivas. Next slide, please. So we would like to disclose that no one on the planning team or faculty have any relevant financial relationships with a commercial entity to disclose. And participants will receive one AMA PRA Category 1 credit for their participation today, as well as one BRN contact hour if you are a registered nurse. Next slide, please. Our first speaker today is Dr. Anthony Collada. So Dr. Collada graduated medical school from St. George's University in 2013. He completed a 4-year residency in psychiatry at Albany Medical Center in Albany, New York, and is board certified in psychiatry. He is an independent contractor through Vituity and has been working at Dignity Health since 2019 for psychiatric consultation and ER services. He also has a private practice in Roseville where he works alongside his mother, Dr. Nadine Yassa, who is a neurologist. Dr. Collada is also the newly appointed Psychiatry Clerkship Director for California North State College of Medicine. He has a great passion for the Coptic Orthodox faith and is aiming to be a good role model for his church community. Dr. Collada, the floor is yours.
Thanks, Tabitha, and thanks for this opportunity. I hope you guys will benefit from this talk today. So some of our learning objectives that Emma and I hope to get across are first, to define decision-making capacity, apply the 4 abilities model for decision-making capacity. We'll have some relevant questions to ask patients in a capacity evaluation. Also, to decide when to utilize a psychiatric consult, ethics, social work consult, or palliative care consult for patients who lack capacity. Also, to understand and explain the role of a surrogate decision maker in the hospital setting and differentiate between a power of attorney and a surrogate decision maker. So if you go to the next slide, we have a poll question here. So if you could answer this poll, the question is: a patient responding with a yes or no to a clinician's questions can be sufficient to demonstrate capacity. It's true or false? So we'll just take a few moments to see the results. Okay, so 71% said false. All right. Go to the next slide. We have another poll question. It goes, all the following are possible causes of altered mental status in hospitalized patients except insomnia, side effects of opioids, side effects of benzodiazepines, acute infection, or none of the above. So we'll give a few moments to get those responses in. And none of the above was 63%. So good majority of you guys got both the questions correct. So capacity is similar to informed consent. In order to demonstrate capacity, a clinician should be confident that the patient has insight into the condition. Another name for insight is understanding of their condition. They've been informed of their treatment options. They can demonstrate a clear rationale to why they're accepting or declining a certain treatment, and they're not going through a cognitive, psychiatric, or medical disorder that can be impacting their decision making. The best way I conceptualize informed consent is like when someone has a surgery and they need to know, is the surgery essential? Do they have non-surgical options? What are the potential risks and benefits to a surgery? What are the risks and benefits to the non-surgical options? So there's a lot of information at play that the patients would use to make a decision or informed consent. And so that's why just someone responding yes or no is really not sufficient to demonstrate capacity. They really have to clearly articulate and communicate what it is they want to do and explain rationale for that. So if we can go to the next slide here. So here's an example of some of the decision-making abilities and what we would often look for when helping to understand if so a question has come up if someone with aphasia could be reliable. So the thing is they have to communicate. So if they're not able to speak, maybe they can communicate by writing. So there is still ability for them to potentially have capacity, but they have to communicate their needs clearly somehow. In understanding, that's also similar to insight, basically do the patients understand the information that's provided to them from the clinician. And oftentimes you can just ask them to summarize the information provided in their own words, and you could get a sense if they understand or not. The second is they have to express a choice. And typically this is pretty consistent. They can't be changing their mind or going back and forth a lot. Sometimes that's a red flag that they would not have capacity. And so an example question to see if they can express a choice is, based on what we've just discussed about blank, what would you choose? Third is appreciation, the ability for them to explain how this information provided can apply to themselves. And they have some example questions here. Can you tell me in your own words what you see as your medical problem? Or regardless of what your choice is, do you think that it is possible the medication or the surgery can benefit you? Do you think it's possible the medication or surgery can harm you, etc.? Also, sort of under this category, appreciation, do the patients understand the urgency of the treatment provided? That can be really important if in any life-threatening or urgent scenarios, they really have to understand that urgency to have capacity. And then lastly is reasoning, their ability to compare information and infer consequences of their choices. Some example questions for this is, how is X better than Y? Or how could X affect your daily activities? So if we go to the next slide, we see some other questions that can be asked, and a lot of these are open-ended questions. What is your understanding of your condition? What are the options for your situation? So these really a yes or no, or even a few phrases may not be sufficient to really demonstrate capacity. The patients really have to explain and articulate, and conversely, the clinician has to be sure they're giving the patient the right education and letting them know all their options to make a good decision for themselves. And so these are just some questions, again, to assess their understanding, their ability to appreciate the information. Tell me what you really believe about your medical condition. What do you think your doctor has recommended for you? Going further down, some example questions. How are you balancing the pluses and minuses of the treatments? What do you think will happen to you now? And it got cut off on the last one, but some questions to ask in order to communicate and express a choice clearly is simply, what do you want to do? Or, you have been given a lot of info about your condition. Have you decided what medical option is best for you right now? So there's various questions or ways to ascertain if they have understanding of their condition and if they're making choices in their best interests, and etc. So a lot of it, though, it does involve sort of open-ended questions, as we can see here. If we go to the next slide, just some take-home points. Consultation with the psychiatrist may be helpful in some cases, although the final determination on capacity is made by the treating physician, whether it's a hospitalist, whether it's a surgeon, whether it's their primary doctor. If they're on the fence or they are unsure if the patient has capacity or not, they can consult a psychiatrist. It's also helpful to clarify with the psychiatrist what about the capacity is being consulted, because capacity can change based on the complexity of the question or complexity of the treatment. So they may have capacity for something very simple or a simple decision, but when it comes to a complex decision, especially someone who has like a heart failure or renal failure or some complex conditions which require more cognitive abilities, may be a little bit more difficult for them to express capacity. So really try to clarify what that capacity question is. Further, if a patient is found to not to have capacity, a surrogate decision maker should be identified and consulted. Or if they're unable to give consent, and identifying a surrogate decision maker will result in a delay that might increase the risk of death or serious harm, physicians can provide emergency care without formal consent. So if we go to the next slide. So there's some risk factors for impaired medical decision-making capacity. This is one source that suggested fear or discomfort in an institutional healthcare setting can be a risk factor. If they're younger than 18 or older than 85, if they have a chronic neurological or chronic psychiatric condition, if they have a low educational level, or if there's a significant cultural or language barrier. If we go to the next slide, there'll be another source here. If you go to the very top in that green box, it has other risk factors, including alcohol abuse, depression, illegal drug use, a history of delirium. And then there's all these factors relating to the present illness and post-admission factors in post-operative patients and intensive care patients, patients that have been ventilated or on the ventilator, or people just generally hospitalized in the setting. So a hospital can be a stressful setting. There can be many confounding variables. And so all of these can be risk factors for this condition called delirium, where people will wax and wane in consciousness and sort of get confused, and it can impact their ability to process information that's needed for that decision-making capacity. So we can go to the next slide. So some diagnostic criteria for delirium include disturbance in attention and awareness. It develops acutely and tends to fluctuate in severity. That's sort of this waxing and waning, where sometimes they seem normal, then sometimes they get confused. sometimes seem normal, confused, etc. And then there's some disturbances in their cognition, and it's not better explained by dementia, although many times people with dementia can also get delirium. And also there's usually some sort of organic cause or causes that are leading into this, such as not sleeping in the hospital setting, maybe it's side effects from medications. And then there's also some various questions or responses people can go through to sort of see if people are delirium, and CAM is one of those assessments. And it says that the presence of delirium requires features 1 and 2, and either 3 or 4. So for 1, it's acute change in mental status with a fluctuating course. They are inattentive, and they either have disorganized thinking or altered level of consciousness. Also during my time in residency, some of the residents did a quality improvement project, and they investigated delirium in hospitalized settings, and they found it was really underdiagnosed. So a lot of people in the hospital setting do develop this waxing and waning consciousness, which can impact their ability to make decisions for themselves. So if we go to the next slide. So I was asked to mention a little bit about clinical depression and how that can impact decision making. So depression in itself can have cognitive side effects that impact people's ability. In one article suggested it can impact their appreciation of the information that's provided. Also, at times we see patients that can be suicidal. If someone is suicidal from a psychiatric perspective, we consider that would suggest they do not have capacity and someone else should make the decision for them. If we can go to the next slide. Okay, so that's sort of what I wanted to talk about, and I hope we can all get this right answer. Patient responding with a yes or no to a clinician's questions can be sufficient to demonstrate capacity. We had most of the people got it right the first time. Hopefully we can get 100%. There we go. Nice. Thank you guys for listening. So we got the next question. It's a little bit tricky question, but I think we can all get this. All the following are possible causes of altered mental status in hospitalized patients except insomnia, side effects of opioids, side effects of benzodiazepines, acute infection, or none of the above. All right, we got the majority got it right. So all of these can cause confusion or altered mental status in hospitalized patients. Okay, that's you guys have been a great audience, and I'll hand it over to Emma from here.
Thank you, Dr.
Thank you, Dr.
Well, thank you guys for those who watched this video. Hope you got something out of it. Like and subscribe for more videos, and send your comments for another topic that you'd like to know more about.